Do you remember that we were told that the way out of this pandemic was to get everyone vaccinated? That was what was going to keep us safe.
That's what the vaccine is for. It's to stop the pandemic. Vaccinations are our armour. They help keep us safe.
We need more people fully vaccinated across more suburbs and more age groups. As we do that, we will be in a better position to safely lift those restrictions that are the hardest to live with.
But what I want to show you next was that literally what has happened to Canada is exactly what happened to those laboratory animals that were tested with the vaccine against the very first SARS virus, where it literally, that so-called vaccine ended up working as an anti-vaccine and made them more vulnerable to the disease than if they had not been vaccinated.
As we've said from the start, the vaccine is a ticket to freedom.
So what we now have is a pandemic of the vaccinated. I'm going to show you the evidence that this so-called vaccine is actually an anti-vaccine and that it has increased people's risk. It increases your chance of getting COVID.
If you are vaccinated, it means that you are less likely to catch the virus.
It increases your chance of spreading COVID.
The more people who are vaccinated, the harder it is for COVID to spread through communities quickly and find our most vulnerable.
And it damages your immune system to such a degree that you have a higher risk of hospitalization and death.
That means while we used to say that we needed to stay home to save lives, we now need to be vaccinated to save lives.
And of course, that's what the narrative that public health keep telling us, that even though they now admit it doesn't stop you getting COVID, it doesn't stop you spreading COVID, they say it'll keep you out of hospital, at least you won't die.
People who are vaccinated will still get COVID-19. It just means that they won't get sick and they won't die.
And I'm going to show you the evidence for why that is absolutely false. So this is a very important study that came out from Cleveland, Ohio. This was a study done on healthcare workers, 51,000 healthcare workers that had had various numbers of COVID injections. And if you can see there are 5 lines there. The bottom of the graph is the passage of time, and they followed these people for 3 months to see who was getting COVID. And of course, the people that are getting COVID are the people who are spreading COVID. So the black line at the bottom is the people that were unvaccinated. 0 doses of the vaccine. They were getting less COVID than anyone else.
Delta is literally bypassing vaccinated people and latching on to the unvaccinated.
The next line up, the red line, is those that had had 1 dose.
79% of eligible New Zealanders have had their first dose.
The green line, 2 doses.
If you had your first dose more than 3 weeks ago, you can now get your second. The quicker we can get people fully vaccinated, the greater the community protection we have against the virus.
The blue line, 3 doses.
The best protection that I can offer and that anyone can offer right now is a vaccination.
And the top line, the brown one, were the people that had had the bivalent booster, the one that's supposed to keep you the safest. They were getting COVID more than anyone else.
Please get a booster. Go and get boosted. The booster is incredibly important. Please do go out and get your booster today.
There was an absolute direct linear correlation that the more shots you got, the more likely you would get COVID and the more likely you would spread COVID.
So that's why we all need to make sure we
get vaccinated.
But what about severe injury and death? This is from New South Wales, Australia. This is 2 bar graphs. The one on the left is a bar graph with 4 bars showing, again, the number of vaccine doses. The graph on the left, those columns are people in hospital. The graph on the right is people in ICU. Just for the sake of time and simplicity, let's look at the one of ICU, the graph on the right. You can see the people that had 0 doses, in other words, the unvaccinated, there were absolutely none of them in ICU. 0.
The virus is literally finding unvaccinated people.
Of the people that had 1 shot, very few in ICU.
So my message to New Zealanders who have not yet had their first dose, if you want summer, if you want to go to bars and restaurants, get vaccinated.
And literally, the more shots they had, the more likely they would end up in ICU. It was an exact linear relationship. The more accumulated damage to your immune system from these boosters, the more harm that you would have from this disease.
The boosters reduce the severity of illness. It means you're much less likely to end up in hospital than if you don't receive a booster.
This was functioning as an anti-vaccine, making you even more vulnerable.
Very soon you won't be able to do many things that you love without being vaccinated, and I expect that will accelerate vaccinations. That is certainly our goal.